Half the population will experience sciatica at some point in their life. Sciatica causes lower back pain, which radiates to the buttock and travels down the back of the leg. Sciatica itself is a syndrome of sciatic nerve irritation, which is the body's longest nerve. The sciatica pain extends to the buttock and the back of your leg. Some people wake up with this pain and it can be dull. For others, it happens after bending or twisting sharply, or just after sneezing or coughing. This pain is almost always in just one leg. The nature of the pain is electric shock-like, shooting or jolt-like, but sometimes it can be burning and dull in around 40% of cases.
Sciatica, and so known as radiculopathy. The straight leg test is the test which diagnoses sciatica. The patient lies on their back. The examiner lifts the patient's leg while keeping the knee straight. If the patient experiences worsening leg pain between about 30 degrees and 70 degrees of elevation, the test is considered positive and indicates nerve root irritation. Crossed straight leg test is another commonly used test where raising the unaffected leg elicits pain in the affected leg. Although this finding is considered highly specific for lumbar disc hernia,
Sciatica affects around 3% of the world population, and the main cause of sciatica is a herniated disc. A herniated disc means a slipped, prolapsed or ruptured disc, and these discs are located between the vertebrae in our spine. Sometimes one of the disc bulges or ruptures and it presses against nearby nerve roots. Most notably, the sciatic nerve. It causes inflammation and irritation and leads to the sciatica pain. This herniation happens due to age or repetitive movement and stress or sudden strain, such as heavy lifting. The weakened disc is more prone to rupture under pressure, so cumulative stress on the spine over time is an important risk factor. In rare cases, sciatica can be caused by narrowing of the spinal canal, which is called lumbar stenosis, or by tumors pressing on nerve tissues. The most common risk factor for sciatica is age, because degenerative processes in the spine require time to accumulate. Sciatica is most common after 45. It is more frequent among men because they usually engage in physical activities that place extra strain on the spine. Tall individuals are at 30% higher risk because they have a longer spine and more leverage acting on their vertebral discs. Obesity, poor core muscle strength, or prolonged poor posture are also important contributors. Smoking increases the risk of sciatica by 100% because it reduces blood flow and nutrition delivery to the spine. Occupations that require frequent lifting, bending, twisting, or prolonged sitting also increase the risk by 50%. Driving, including exposure to whole body vibration, is another risk, with microtraumas contributing to spinal stress. For the diagnosis of sciatica, signs and symptoms are the Lean criteria. Pain radiating down the back of the leg, often below the knee, following the path of the sciatic nerve, is typically worse than any associated back pain. The pain is often described as sharp shooting, burning, or electric-like. Numbness, tingling, pains and needles, or muscle weakness may be present in the same leg or foot distribution, and a positive straight leg raise test is observed. While imaging like MRI can identify the cause, for example, a herniated disc, this diagnosis of sciatica itself is based mainly on these clinical findings. The prognosis of sciatica is generally good. 75% of patients will experience significant improvement within 4 weeks, even without treatment. And 9% of patients will recover with non-surgical treatments within 3 months. However, about 20 to 30% of individuals may experience persistent symptoms beyond 1 year or have recurrent episodes. Now, let us talk about treatment. Avoiding activities that worsen pain, such as prolonged sitting or heavy lifting, while staying gently active, such as avoiding strict bed rest, is recommended. The first-line medications are anti-inflammatory non-steroidal drugs like ibuprofen and naproxen. Sometimes a stronger medication such as diclofenac is used. In cases of severe back pain or muscle spasms, muscle relaxants are used. And if the pain is chronic or does not respond to treatment, or if nerve irritation symptoms dominate such as burning, tingling, and shooting sensations, then gabapentin or pregabalin nerve pain medications can be used. Sometimes steroid injections are used, such as dexamethasone or triamcinolone, which are longer acting. Sometimes, when anti-inflammatory non-steroidal drugs are contraindicated, systemic oral steroids are used, like prednisone, for a short course up to 2 weeks. They are sometimes prescribed for severe acute sciatica, particularly when intense radiating leg pain starts suddenly and is thought to be caused by significant inflammation. For instance, from a large herniated disc. Current guidelines often recommend structured exercises or physical therapy to support recovery and prevent recurrence. When conservative treatments do not provide sufficient relief, or if neurological deficits worsen, surgery may be considered.